Do you wake up every morning with your mouth feeling like sandpaper, your tongue sticking to the roof of your mouth, your lips cracked and dry, reaching for water before you even open your eyes? If that sounds familiar, I need you to stop what you're doing and pay close attention. Because what you've been dismissing as just another annoyance of getting older is actually your body's urgent warning signal. And ignoring it could have consequences you never saw coming. After more than 25 years in medicine, I've watched this single symptom destroy lives. Not dramatically, not overnight, but quietly, slowly, in ways that only become visible when it's almost too late. A 2022 study published in the Journal of the American Geriatric Society found that chronic dry mouth, what we call xerostomia in medical terms, has a direct statistical connection to 4 of the most dangerous health crises facing adults over 60. Aspiration pneumonia, systemic infection, progressive malnutrition, and medication toxicity. But what if I told you there's a way to identify the hidden dangers your dry mouth is revealing right now before they spiral out of control? In the next 10 minutes, I'm going to walk you through exactly what your body is trying to tell you, the warning signals most doctors miss, and the precise steps you need to take starting today. Let me tell you about Eleanor, because Eleanor's story is the reason I'm making this video right now. Eleanor was 68, a retired librarian from Virginia, the kind of woman who spent 4 decades helping everyone else and never wanted to be a fuss. So when she started waking up every single morning with a mouth so dry she could barely swallow, she said nothing. She figured it was aging. She figured it was normal. For nearly 2 years, Eleanor woke up like that every day, and during those 2 years, her body was screaming in the only language it had left. She started losing weight, just a pound here, 2 pounds there, until her son noticed her clothes weren't fitting right anymore. She had trouble swallowing dry foods like bread or crackers. Then came the infections, a chest infection in spring, another in fall, another the following winter. Each time, antibiotics, each time sent home. And each time, nobody asked the critical question, why does this woman keep getting respiratory infections? Then came the morning that changed everything. Eleanor woke up gasping for air, her lips tinged blue, her son calling 911 with trembling hands. Her oxygen levels had dropped to 79%. Healthy adults sit at 95% or above. The diagnosis from the pulmonologist stopped her family cold. Severe aspiration pneumonia, developing not over days, but over many months. Here's what that means, and why it matters directly to you. Every night while Eleanor slept, bacteria from her dry, unprotected mouth were being microscopically inhaled into her lungs. This process is called microaspiration. It actually happens to everyone during sleep. But here's the difference. In a healthy mouth, saliva acts like a defensive army, neutralizing those bacteria before they can travel anywhere dangerous. Saliva contains powerful immune compounds, immunoglobulin A, lysozyme, lactoferrin. These are your mouth's immune checkpoint, working 24 hours a day. Eleanor's mouth was dry. That checkpoint had been dismantled. And for nearly 2 years, bacteria had been making their way into her lungs every single night while she slept peacefully, completely unaware. 17 days in intensive care, permanent lung scarring. And here's the part that haunts me to this day. When her son went through Eleanor's medical records during those 17 days, he discovered something shocking. Eleanor had been on 6 medications for over 4 years, and not one physician had ever reviewed how they interacted with each other. 4 of those medications, a blood pressure pill, an allergy antihistamine, an antidepressant, and a bladder control drug, all belong to a class called anticholinergics. These are among the most aggressive suppressors of saliva production in modern medicine. Eleanor's dry mouth wasn't a minor side effect. It was her body sounding a 5-alarm fire for years, and nobody was listening. This wasn't bad luck. This was the predictable outcome of a problem affecting 30% of adults between ages 65 and 75, and nearly 40% of those over 75. And it comes down to 5 critical facts that most doctors never clearly explain. Today, I'm explaining all 5, plus the 7 warning signals your dry mouth may be hiding right now. First, saliva is not just for chewing your food. It is one of the most biochemically complex fluids your body produces, containing over 700 different proteins, enzymes, and antimicrobial compounds. Think of it as your mouth's immune system, your digestive ignition switch, and your throat's protective coating, all rolled into one. A 2021 study from UC San Francisco, tracking over 12,000 seniors, found that those with confirmed chronic dry mouth were 2.8 times more likely to be hospitalized for respiratory infection within 24 months. Nearly 3 times the risk, hiding in a symptom most people dismiss before their first cup of coffee. Second, medication combinations are far more dangerous than anyone tells you. Over 500 medications commonly prescribed in America list dry mouth as a side effect. Blood pressure medications, antidepressants, antihistamines, diuretics, bladder control drugs, sleep aids. Now here's what most people don't realize. When seniors take 3 or more of these simultaneously, the effects don't just add up, they multiply. Research published in the Journal of the American Dental Association in 2023 found that 3 xerogenic medications don't cause 3 times the dryness. They may cause 6, 7, or even 8 times the suppression of your salivary glands. This is called the compounding xerogenic effect, and almost nobody discusses it during routine prescription reviews. Third, dry mouth causes malnutrition even when you think you're eating normally. And this surprises every patient I explain it to. Saliva doesn't just wet your food, it triggers your entire digestive cascade. It contains an enzyme called amylase that begins breaking down carbohydrates in your mouth, and it sends chemical signals to your stomach to prepare digestive acid. Without adequate saliva, that signal goes quiet. Food passes through your system without being properly absorbed. A 2022 Mayo Clinic analysis found that 44% of seniors diagnosed with unexplained malnutrition had clinically significant dry mouth that had never been identified as a contributing factor. You can eat 3 meals a day and still be slowly starving at the cellular level. Fourth, a dry mouth is an open door for dangerous bacteria to reach your heart, brain, and bloodstream. Your mouth naturally hosts around 700 species of bacteria in a carefully balanced ecosystem, and saliva is what regulates that balance. When saliva production drops, the dangerous bacteria Streptococcus mutans, Porphyromonas gingivalis, Fusobacterium, they surge within just a few weeks. And according to research published in Nature Reviews Microbiology in 2023, they don't stay confined to your mouth. They enter your bloodstream through microscopic breaks in gum tissue, and they've been directly linked to heart valve infections, worsening diabetes control, accelerated cognitive decline, and sepsis in vulnerable seniors. Fifth, dry mouth is almost never just one isolated thing. It's your body's way of signaling something deeper that hasn't been diagnosed yet. And that brings me to the 7 critical warning signals I promised you. Pay very close attention to this section, because this is where most doctors completely drop the ball. But before I give you the list, let me ask you something. How many medications are you currently taking? Because the second story I need to tell you is critical if that number is 3 or higher. Robert was 66, a retired firefighter from Georgia, 30 years walking into burning buildings. So when dry mouth started waking him every morning, he did what tough men often do. He ignored it. 2 years went by. Then the tooth pain started. When his dentist looked inside his mouth, she paused before speaking. 9 teeth destroyed by aggressive decay in just 16 months. She had only seen progression like that in cancer radiation patients. She started asking questions. She discovered Robert's acid reflux medication combined with his blood pressure diuretic had chemically stripped his mouth of protective moisture for 2 solid years. But the teeth weren't even the worst part. The dentist took a bacterial culture from his gums. What came back made her pick up the phone immediately. Robert's levels of oral Streptococcus mutans were among the highest she had ever documented outside a hospital setting. A 2023 Johns Hopkins study of over 8,000 men aged 65 to 75 found that elevated oral Streptococcus mutans was associated with a 34% increased risk of a major cardiac event within 18 months. Robert's cardiologist found early arterial inflammation on follow-up testing. Medications were adjusted. Dry mouth was treated aggressively. Robert is doing well today, but he was less than 6 months from a potential cardiac crisis. And a dentist asking the right question about dry mouth is the only reason he's still here. Now the 7 signals, here they are. Signal number 1, ammonia or metallic breath combined with dry mouth. If your morning breath smells chemical or metallic rather than just stale, that's a potential kidney function warning. You need to request a comprehensive kidney panel from your doctor this week. Signal number 2, thick, ropey, or foamy saliva. This isn't an absence of saliva, but altered saliva consistency. This is a potential autoimmune signal. Sjogren's syndrome, lupus, rheumatoid arthritis. Request autoimmune antibody screening. Signal number 3, dry mouth only at night, but fine during the day. If daytime feels normal but mornings are severe, this is a direct sleep apnea pattern. Your airway is collapsing during sleep, forcing mouth breathing for hours. You need a sleep study. Signal number 4, dry mouth plus frequent nighttime urination. This combination is a diabetes red flag. High blood sugar pulls water from every tissue in your body, including your salivary glands, while simultaneously driving up urinary output. Request a fasting glucose test and hemoglobin A1C immediately. Signal number 5, dry mouth plus dry, gritty eyes. This is the classic presentation of Sjogren's syndrome, affecting an estimated 1 in 70 women over age 60, and it's dramatically underdiagnosed. It's treatable, but it can progress to affect kidneys, lungs, and the nervous system if missed. Signal number 6, dry mouth plus leg cramps or foot cramps. This combination flags a serious electrolyte imbalance, low sodium, potassium, or magnesium. This is especially dangerous if you're taking diuretics. An electrolyte crisis combined with dehydration can trigger life-threatening cardiac arrhythmia. Call your doctor this week. Signal number 7, dry mouth that started within 90 days of beginning a new medication. This is your body telling you it needs a medication review immediately. The 90-day window is when anticholinergic suppression reaches its clinical threshold. Do not wait for your next scheduled appointment. Bring this up now. So what do you actually do about it? 7 steps straight from my own clinical practice protocol. Step 1, the morning mouth assessment. Before you drink anything when you wake up, take 60 seconds. Is saliva present? Is it thin or thick? Any unusual smell? Can you swallow comfortably without water? Do this daily, and you'll have the data your doctor actually needs to help you. Step 2, the medication audit. Write down every medication you take, prescription, and over-the-counter. Check each one online or in the package insert for the words anticholinergic or xerogenic. Then tell your doctor this exact phrase. I would like a formal medication review focused on my combined anticholinergic burden. Those specific words will change the entire conversation. Step 3, understand that water alone does not fix dry mouth. Your salivary glands need electrolytes, sodium, potassium, bicarbonate to actually produce saliva. Plain water can actually dilute those electrolytes further. Small, frequent sips throughout the day, paired with electrolyte-rich foods like bananas, leafy greens, and broths, is far more effective than chugging a glass at bedtime. Step 4, the nighttime protection plan. Elevate the head of your bed 4 to 6 inches using bed risers, not extra pillows. Run a cool mist humidifier in your bedroom at 40 to 60% humidity. Use a xylitol-based dry mouth rinse, never alcohol-based, immediately before sleep. These 3 changes alone can cut nighttime mouth dryness by up to 50%. Step 5, saliva stimulation throughout the day. Chew xylitol gum after meals. Suck on sour, sugar-free candy to activate your parotid glands. Eat crunchy raw vegetables with every meal, carrots, celery, bell peppers. These are clinically supported, simple, and cost nothing. Step 6, your doctor conversation script. Say this exactly. I've been experiencing chronic xerostomia that's affecting my sleep, nutrition, and ability to swallow comfortably. I'd like to discuss whether my current medications are contributing, and I'm requesting a salivary gland function assessment. Clinical language gets clinical results. Your doctor will take you seriously when you speak their language. Step 7, know the emergency red flags. Dry mouth with difficulty breathing, get to an emergency room now. White patches inside your mouth, call your doctor today. This is oral thrush, a fungal infection. Dry mouth with sudden confusion or weakness, call 911. Dry mouth with chest pain or rapid heartbeat, call 911. Dry mouth with unexplained fever, same-day urgent care visit. Do not wait on any of these. Let me quickly address what I know you're thinking. Your doctor told you it's just aging. Is that actually true? No. Clinically significant xerostomia is almost always caused by a medication, an underlying medical condition, or both. It's just aging is a dismissal, not a diagnosis. You have every right to push past that answer, and now you have the vocabulary to do exactly that. Can drinking more water fix it? No. Dry mouth is a salivary gland function problem, not a simple hydration problem. You cannot water your way out of a broken pump. And yes, if you wear dentures, dry mouth is still dangerous, arguably more so. Bacteria colonize aggressively beneath denture bases against your gum tissue without saliva to regulate them. You do not need natural teeth to suffer the systemic consequences of chronic dry mouth. Now let me bring you back to Eleanor because her story doesn't end in that ICU. After 17 days, she came home, weaker than she'd ever been in her life. But her son came home with a plan. He documented everything, every dismissed symptom, every medication, every missed interaction. 3 medications were adjusted. 1 was stopped entirely. Within 6 weeks, Eleanor's dry mouth was almost completely resolved. Within 3 months, she had regained 9 of the 13 pounds she had lost. Eleanor volunteers now at a senior wellness center twice a week. She hands out a laminated card her son designed, the 7 warning signals in large print, over 150 of them distributed so far. And every single time someone takes one, Eleanor says the same thing. I thought it was nothing. It almost killed me. Please don't make the same mistake I did. The truth is, at 60, 70, 80, the goal isn't just to live longer. It's to live better, with independence, with dignity, with the joy you've earned. Your body is constantly communicating with you. Dry mouth and dry lips every morning isn't background noise. It's a message. And now you know how to listen. Start small today. Commit to the morning mouth assessment, check your medications, and schedule that conversation with your doctor using the script I gave you. If this video was helpful to you, hit that subscribe button so you don't miss the next one. Share this with one person over 60 in your life. One person. You may be handing them information that genuinely changes their health trajectory. I'm Dr. Mark Westfield, and I'll see you in the next one.